Physicians Advisory Group, Dr. Hoa Nguyen. We had you on last week, Doc, and you were talking about what you believed was a plateau in the numbers. But in talking to you over, since then, you're feeling a little bit differently this morning?
Yeah, I'm surprised that the number is still kind of so high. You know, we're really different in the States for some reason. The Delta surge in the States seemed to died out about 5 to 6 weeks. And, you can see a lot of people in the state now that uh, somewhat back to normal with and a lot of events that have people don't wear any masks, but for some reason the Delta surge are coming down, trend downward in the state. But in Guam, I'm not quite sure what the difference is, but our numbers seem to be, keep up in the triple digit. And again, we are the highest ranked um, uh, area in this compared to the state at this point on our positivity rate. And it's a big concern, and not sure because our comorbidity or our family value that we like to get together so much, but yeah, this is really surprised that it's still triple digit, and that's something that we probably need to go out and really hammer on the 3W and again, try to discourage people and control people on the gathering. We right now is not in the company. It's just all on the home situation and the gathering. So we need to put some campaign out there somehow. But I don't see any campaign at this point. We really do need to go back to stress about the gathering, the social distance, the use of masks and washing your hand. And that's something we really have to do, because if not, with no further restriction that come in play, our people are going to suffer a lot.
Oh, they are suffering, Doc, but that apparently is the plan. Is they can't stop the spread, so let it spread. We had Dr. Bob on yesterday. He said this current set of restrictions. I'm using my air quotes here because I don't believe they're really restrictions. They're absolutely not working at all.
Yeah.
He said that, yeah, we're going to keep these in place until the unvaccinated get sick and we get the natural immunity.
There's a lot of people life going to lose here if we continue to do that. So I think we really have to do something else beside what we do at this point. It's clearly it's not working to curb the surge. And we have quite a few deaths in the past few weeks. There's a lot, and I think Dr. Bob is very seasoned, and I think that he would pick it up, and hopefully we need to go back and identify why people are dying. You got to go back to square one, to the point where they how long they've been sick, where they get tested, the place where they get tested. The physician talk to the patient when they test positive to try to identify if they are high risk or not, because now we have the monoclonal antibody here. Those deaths, I would go back and interview the family to see, where they get tested, if anyone call and talk to them to kind of offer them the monoclonal antibody treatment or not, why they wait at home for so long, what the reason. We really need to find out all those reasons and try to fix it, right? I mean, we keep telling people that, hey, why they wait so long? But like I say, we really need to dive into the family of the people that lose their life in the past few weeks and see what we can do to make intervention ahead of time to try to help them so they don't lose their family member. I know most people and some people don't get access to the media, and I know we can assume that people know what's available out there, but we really need to look at those deaths and see what can do difference and reach out to the like you say this morning, is maybe those are now they not is a minority that they're doing that, or they social economic that they in a disadvantage that they don't know. But we have to need to reach out to those people somehow, identify why they wait at home for so long, and try to fix it. We can't assume people know everything that we know. So I hate to see people losing life like this, vaccinated or unvaccinated. They should be treated the same at this point. A life is a life.
Doc, people are freaking out about this 16-year-old COVID-related fatality. It's like it couldn't come at a worse time. I mean, 9 weeks into this surge, I mean, really, you're right. They pass it off on the mayors. They're making the mayors go call people. But what happened to the things we did that worked earlier? The rapid engagement team going house to house. I just can't accept that we're supposed to just get used to this.
Oh, I tell you, we cannot get used to this. It's you burning out the healthcare provider, you lose a lot of life. So I don't think we can get used to this thing. Like I said, we really have to go back in that we have 40 something death now since the surge, right? We're gonna go back and look at every those situation, because when I look at it, some of these people they test positive before. The question is, did someone identify them a high risk and refer them? It's like our clinic, right? Every time you're positive, a physician actually get the phone and talk to you, and try to identify your risk and refer to the infusion site. Question is, other place where they do the testing, do they just say you're positive and let you go, or do they identify them? There's a physician that called the patient to talk to them or not. We need to go back and look at every case individually and see what we need to do to improve. And that's the problem we have in the past, is that at the testing site, they test positive and they let them go. And we don't really offer them treatment. But now that we have treatment, we really need to go back and see, hey, where those people, I know besides the DOA, most of the people have been test positive, a few days before they die. So the question is, do they get a chance to get the antibody, monoclonal antibody or not? Do they go back and look at them? Because if we can save one life, it's a life that we save. So, and like I said, we gotta stop talking about vax and unvax. Really, we have to respect everyone, and we need to make sure that talk to unvax as much as possible. Like yesterday, I have a patient that very reluctant to get vaccinated, but after about half an hour talking, the patient agree and understand, and she will get the vaccine. So we really have to reach out and educate people and give the right info, rather than saying, hey, unvax, you're going to bear the burden and you're going to die. And it's not fair to say that.
I mean, I hear you, Doc. But I mean, what are we supposed to do? We can keep saying it all day long, that.
Yeah, we have to get out there and do some campaign out there. Sabrina, I mean, it's really like I say, if you cannot convince someone to get vaccinated, doesn't mean that you give up on them and wait until they get sick. Like I say, they all get tested now, vax or unvax. So you really have to identify at the site. It's very important. I know quite a few places that we just test and they positive and no one talked to them. You got to reach out to the positive and talk to them, every one of them. If you're going to do the testing, you have to have a physician or dedicate the seasoned nursing staff to interview the patient once they turn positive. You cannot let this high-risk positive go home without talking to them at length and offer them the infusion. we are no longer shortage in infusion. Medication, we have a lot now. So, those infusions cut down about 7% of the risk that you end up in the hospital. That's a lot of life saving right there. So we got to go back at every one of them. Again, this is a challenge Dr. Bob LG have to do is basically look at every case that people die and see if we can do anything better on the next person to save one life at a time.
You mentioned about the Delta variant in the mainland. It's like, 5 weeks and it dies down. Here it's 9 weeks and we're still on this upward track of positive cases and COVID-related fatalities and hospitalizations. Could it be another variant? I mean, we haven't heard any results from COVID positive samples that have been sent to the CDC, but have you heard anything?
No, Sabrina, yeah, you're right. It's quite a long time that we have anything coming back from CDC. So the question is, did we send out any and anything come back? It should be a lot faster now since, they can do that a lot quicker than before. So I still think that from all the breakthrough positive that we have from the fully vaccinated, that there gotta be Delta variants. And that's Delta variant is the only one that's so highly infectious that that you can break through the vaccine. We see people that that been vaccinated in April, May that still have breakthrough on infection right now, and we are correct. When you have breakthrough, the majority of the breakthrough infection, people are not that sick. And I have to say that's a wonderful part about the immunization, that people are not that sick. But the problem is that when people are not that sick, they're going to transmit the virus too, because they still go around not knowing that they have COVID. Wow. And that's the major problem, is that we need to kind of educate people that, hey, when you're fully vaccinated, you don't have the typical COVID symptom. And you have to pay attention to your symptom, because you might have just a bit of runny nose, and a bit of headache, a little bit of cough, but we cannot assume that's a common cold. And that's where you need to get tested, so that way you can identify yourself and protect people around you. So that's the key message we need to put out there for us to kind of curb this restriction. If we're going to put any curb this surge, because we're not going to put any more restriction on the community, then we need to educate the community a whole lot and identify this mild symptom, especially on the fully vaccinated people.
Yeah, right. Doc, you talked about campaigning, and I'm sorry, I'm just going to say it out, but I hear that the re-election campaign is the only campaign that's going right now. And that's exactly what we need. We need, as hard as they're working on getting re-elected at this time when people are dying, we need to work that hard to stop this insanity. We do. In this election time, you turn on the TV, you turn on the radio, every other commercial is vote for me, vote for me, vote for me. At this time, every other thing I hear should be, don't wait until it's too late. Do this. Go get tested here. We have the money. We're here to help. We're begging public health, begging the governor to come on here and talk to the people. But that's the type of response we should see. Instead of them concentrating on getting reelected, like that's what?
Yeah. Guys, there's a part where we can't wait until people catch the virus, or you got to do some preventive stuff. And I think that education campaign on what identify the symptom on the fully vaccinated people is one of the key point here to curb this surge. And because I tell you, we are 87% vaccinated now, fully vaccinated, and the positivity rates have not coming down. So we really have to kind of jump on the wagon and basically educate people how to identify these this mild symptom that they have, so that way they can get tested, isolated. Just like we have a few children in the school yesterday turned positive, and they have very mild symptoms, but they still go to school, and that's something that absolutely we have to educate the community on, make sure that you identify this mild symptom and get tested. I mean, it's true amazing that people still think that they have a cold, and they got to make sure that they know that, hey, you fully vaccinated doesn't mean that you cannot catch it. People still think that they cannot catch the virus when they are fully vaccinated.
Doc, we have people in our government saying that on this show.
I know.
Yeah.
You can encourage immunization, but you have to also educate that, hey, you will catch the virus still, and you can still transmit it. So, you got to do things differently. Right now, we don't do anything differently.
So again, then, Doc, I ask you, what should we be doing right now differently?
Since Sabrina said we not put any more restriction on the community, and we let the community run its own course, I think education part is a big part of the preventive, the prevention that we need to do. So put some ads and campaigns, some TV ads together on educate people on how to identify this, the mild symptom, especially on the fully vaccinated. So that way people would know, right? I mean, that should be posted everywhere. And so that way that, hey, if you have a cough, congestion, anything like that, please do not assume that you have a cold and go get tested, so that way for sure. Like I say, that's what we see on the clinic level, as people that think they have a cold, they end up have COVID. And that's something that before they get tested, they are running around, interact with each other for about, at least 2 to 4 days before they come in to get tested. And it's too late already. They transmit the virus to other people already. So the education part is a big thing that we need to do. I don't know how to approach that. There's some people that are very smart how to do the campaign, but I think that's something we need to do since there's no more restriction out there right now.
Right, yeah. The doc, you said 4 students positive?
What we see in our clinic, yesterday we have 6 students. And those can be prevented if we educate the parents a little bit more on the number one, if you have a positive family, please do not send your kid to school. That's why I tell before, if you have a positive, doesn't matter the father, the mother, or the sibling, please don't send your kid to school just because the other children in the house need to be tested before they go to school. But you don't send your children to school if one of the siblings are sick, and you don't know they're positive or not. And that's what we see is that, you can keep a sick child home, but you send the rest of the children to school. That's a big mistake. So there's something that the parents need to be aware, because once you test your sick child positive and you send the other kid to school, they test positive. So parents really need to pay attention, because we really need to create a safe environment for our children to go back to school. Mm-hmm. You cannot close the school.
Sorry, we're going to have to jump over because these guys have more questions. Doc, if you could just stand by for just a second. It's 8:01 on the breeze. We're KUAM FM. I got you, Guam, KUAM TV. Here we come. Good morning. Good morning, Guam. My name's Chris.
Hi, I'm Sabrina.
I'm Jason. Good morning. Happy day, everybody.
All right, we're in the KUAM Link Zoom room with Dr. Hoa Nguyen, the former chair of the Physicians Advisory Group of American Medical Center Family of Clinics. Bree was in the middle of asking the doctor a question. And so, Sabrina Salas-Mantanani, good morning.
I wanted to follow up on you had mentioned that you're seeing school children testing positive. Is that what you said? And if you, yes, right?
Yes.
Okay. And so were they under 12 or were they eligible to be vaccinated? How young?
You know, the one that we saw is they fully vaccinated. You know, so this anywhere range from 10 years old to 17. You know, so like I said, I mean, I think what we need to ask the parents that if you have a positive in the family that live in the same house, you know, doesn't matter if your children have symptom or not. No, please get them tested before you send your child to school. Okay, and you know, just not one test. I would test one time, and then 3-4 days later, I would test the second time to make sure that your children didn't have the virus. So if you have a positive in the family, please don't send your children to school unless they get tested before they go to school. If you have a sick child in the house, get that child tested to make sure there's no COVID before you send the rest of the other siblings to school. Wow. So those are those actions that parents can take to protect the school, right? But just don't send the child to school or the children to school if you think they have a cold without testing. And like I said, I mean, you don't want them to report that which school have positive. And I say, I hope public health and the school have I think the school have a very good plan together on contact tracing. And they just need to put out in the public appropriately, the information appropriately, and so that way the parents do not have to worry about if their children have been exposed to someone positive or not. I think that's a matter of communication, put out there the right information so the public does not get scared or panic when you have a positive in school.
Jason, did you have a question?
Yeah, Doc, if I may, I just wanted to piggyback on something that Sabrina was asking a few moments ago when she was talking about, like the variants, because, if people read national news, they know that there's the new Mu variant, and prior to, adopting, Greek letters, it was, the UK variant, the India variant. Is it even remotely possible that one of the reasons why this thing has become so out of control on Guam is because is it possible that it perhaps mutated and there's a new variant that originated here on this island? Or is that too remote of a chance?
Yeah, that's really remote chance, but the higher your number of positive rate, right, the higher number of people get infected, the higher risk of the virus change itself and become a new variant, right? I mean, that's where I think that I hope that they still sending sample to CDC to identify what type of variants we have on the island that prominent at this point. So we haven't heard anything coming back from CDC yet for a long time now. So but the Mu variants is luckily that the Delta is so infectious that it kind of dampens the Mu variants, right? That's a big part of it.
Yeah.
That's the lucky part. Hopefully, when the Delta variants surge are coming down, that the Mu variants is not coming up. So again, this is not going to be the last variants. They're going to mutate as long as we have more people infected. I think the big part about our island, seriously, we have a lot of comorbidities, and our culture is different. We tend to get together a lot more, than people in the state. Yeah. So that's the two things that are against us. I think that's why it has remained high for so long.
Yeah. And then plus too, Doc, we really sold vaccination as a return to normal. And so I think when we had such a high vaccination rate, a lot of people just assumed because the government messaging was telling them that we're back to normal and everything is okay. And so I don't know.
Yeah. So I tell you, we still see a lot of people use the masks out there. So we really appreciate that. Again, right now we need to put the info out is that the transmission is within the family. Okay. So any family gathering, we really need to pay attention to a large gathering within the family. So it's not in the company. So the large gathering in the family, the family really need to pay attention to that.
Thank you, Doc. We just got someone texted me. We have the Mu variant. Next, there's a variant from Guam. It'll be the Lu variant or the GU variant. I mean, it's the last thing we want, though, guys. It's the last thing we want. I mean, knock on wood.
Again, I just asked them to go back to basic, and Dr. Bob will get his feet wet, and hopefully, he will do the right things and put some campaign together, identify why people are dying, and then try to make correction for that. I think that's the most important thing is that, we can have positive out there, but we hate to lose life. And we really need to go back and really work on every one of those deaths and see what we can do better next time that we can take an early action to try to save people's life. I think we can make improvement if we find out exactly why they're dying, because no one talked to them, no one offered them the infusion. Because they worry about money to go to the hospital. Yeah. It got to be something. We can't assume that people dying because they wait too long. I think we need to get that out of the way. We need to find out why.
Right. Thank you, Doc. Appreciate your time this morning and the seriousness with which you approach our conversations.
You're welcome, guys. Just from our people, we have to be safe and please practice the 3W and kind of respect each other. And again, fully vaccinated or not, just use your mask, okay, and social distance.
Thank you, Doc.
Thanks, Doc.
You're welcome, guys. Have a good morning.
You too. We'll try. 810. Dr. Hoa Nguyen of the Physicians Advisory Group. Yeah, a lot of great points really brought up in their Rosemary comments. They're leaving it up to the mayors now. Yeah, we had that rapid engagement team, right? They went down into these trouble spots and they tested people. So how do we go from that and de-evolve into phone calls? And the thing is, we have the money. The governor could hire 20 people at public health right now yesterday. She could.
That's also interesting because Doc has always, preached throughout the history of the show is always, like personal behavior, personal choices, talking with your family, consulting with your physician. And now he's actually calling on specific messaging from government.
Yeah.
And saying it's got to be, like across the different
I mean, they
media
have
platforms.
struggled with the messaging this whole pandemic. And I got to say, their lack of messaging, their failure to effectively communicate, it's cost people's lives. It really has. People have died because of their inability to communicate critical information in a timely manner. I'm sorry, that's the facts. It's 8:11, brought to you by Pacific Points. Let's go ahead and get into our 8 o'clock newscast for the very latest from the KUAM News team.